Ah, fuck. I rolled my ankle.
Calm down, Stewie. What happened?
Some bitch's foot was under me, and I landed on it and rolled my ankle.
Sounds like you have an inversion sprain, Stewie. An inversion ankle sprain is when the lateral ankle ligaments get stretched to the point of tearing. A grade 1 sprain is the tearing of some fibers. A grade 2 sprain is tearing of more fibers, but the ligament is still intact, and a grade 3 sprain is a full rupture of the ligament.
Am I going to be okay, A.T. Peter?
Yes, you are, Stewie. Let's check this out. Tape you up and get you back into your ballet recital.
Oh, my leg.
Stewie, are you all right?
I was on the field running, and I went to move laterally and felt a pull on the inside of my leg.
Have you ever felt something like this before?
Yes. I've hurt my hamstring before, and it feels similar, but this time it's on the inside of my leg.
Okay, let me do a quick sideline assessment. You have pain and weakness with active and resisted adduction, and pain with passive abduction too. I suspect you've strained one of your adductor muscles, Stewie.
Can I go back in the game, A.T. Peter?
Well, Stewie, if you don't have 90% strength and 90% range of motion, I can't let you go back out there. Letting you go back out may increase your risk of further injury and take you out for even longer.
Blessed. All right. A.T. Peter, how long will I be out for?
We won't know until I get a better look at it after the game and see how you feel tomorrow. For now, let's rest it and go support your teammates.
Thank you, A.T. Peter.
Like and follow for more A.T. Peter content. Comment what injury we should do next.
Ow, my knee.
Stewie, what happened?
I was running, and I went to cut, and planted my foot, and felt a pop in my knee.
Okay, Stewie, I see that your knee is starting to swell and your hamstrings are guarding your knee. I'm going to do a Lockman's test.
Am I all right, A.T. Peter?
Well, Stewie, I felt some laxity in your ACL with a poor endpoint, so I think you sprained or torn your ACL.
My career is ruined, A.T. Peter.
No, it isn't, Stat. We are going to rehab this knee the best we can to get you back as soon as possible.
Thank you, A.T. Peter.
Stewie, are you all right?
Oh, A.T. Peter, I went to do a flip, and I landed on my head and hurt my neck.
All right, Stewie, sit still. I'm going to stabilize your C-spine. When I ask you a question, answer me yes or no, and do not shake your head.
All right, A.T. Peter.
Do you have any tingling or numbness in your fingers or toes?
Yes, I feel lots of tingling, and it's hard to move my toes.
All right, bud, I'm going to activate my emergency action plan, and we're going to get an ambulance here. While we wait, I'm going to stabilize your C-spine, collar your neck, and monitor your vitals. Hey, it's Paramedic Peter. Let's get you on the spinal board and get you to the hospital for testing.
Am I going to be all right, A.T. Peter?
You're in good hands with these guys, Stewie.
Thank you, A.T. Peter.
Like and follow for more A.T. Peter content. Comment what injury we should do next.
Oh.
Stewie, what happened?
I did my pirouette, and fell, and landed on my outstretched hand, and now I cannot move my arm.
Hey, Stewie, it looks like your shoulder has dislocated. You have good distal circulation. I'm going to get Dr. Peter. Hey, Stewie, it's Dr. Peter. I'm going to put this arm back in place. All right, ready? 1, 2, 3, pop!
Oh, that really hurt.
You're all back to normal now, Stewie. Let's sling you up and get some imaging.
Am I going to be all right, A.T. Peter?
We don't yet have x-ray vision, but typically when you dislocate your shoulder, you can tear part of your labrum, which may need surgery. You could also fracture part of your glenoid rim or your humeral head, but we will not know until imaging is done.
Thank you, A.T. Peter. I can't wait to get back to ballet. Oh, my heel.
Stewie, what happened?
I was backpedaling and went to transition into a sprint, and it felt like someone kicked the back of my heel, and I heard a loud pop.
Okay, Stewie, can you try and point your toes down?
I can't do it, A.T. Peter.
I can see and feel a deformity in your Achilles. Let's get you on your stomach to do a Thompson test. I'm going to squeeze your calf to see if there's any plantar flexion. The test was positive, so I suspect you have ruptured your Achilles tendon.
What am I going to do, A.T. Peter?
For now, let's get you into a boot with a heel lift.
Why do I need a heel lift? Is it because I'm short?
Heel lift will allow us to approximate the tendon, too, prevent further stretching of the rupture. We'll also fit you with a pair of crutches before we get you to the hospital.
What are they going to do to me at the hospital?
At the hospital, they'll discuss the best way to repair this injury, either surgically or not, based on factors like tear severity, tear location, your activity level, and your preference.
Thank you, A.T. Peter. I cannot wait to get back on the field to play some more football. I just wish they didn't use my head as the ball.
Like and follow for more AT Peter content. Comment what injury we should do next.
What happened to my glorious King Jason Tatum last night, A.T. Peter?
Let's take a look at this ankle injury to Jason Tatum, also known as the anomaly. As we see here, the anomaly takes a hard, sudden step back with his right leg before collapsing. This step puts the ankle in a dorsiflexed position, which results in a large eccentric load on his Achilles, while his Achilles is in a lengthened position. When you put the Achilles in this position and put a strong explosive force through it, it can result in that tendon to fail and tear. From this other angle, you can see the calf recoils suddenly, which is another common sign of an Achilles tear or rupture. We won't know until an official report, but based on the mechanism, the calf recoil, reaction, and unwillingness to wait bare, we can assume a significant calf or Achilles injury has occurred, and he will most likely be out for the rest of the playoffs.
Thank you, A.T. Peter. I just hope my glorious King Tatum is all right, and the Celtics make a comeback.
Like and follow for more AT Peter content. Comment what injury we should do next.